Time is something we never get back, and we all want as many minutes with our parents and grandparents as we can share. Looking through a window isn't the same as talking and holding a loved one's hand, but it's something we've all had to do to protect the lives of those living in long-term care. So how long will this adjustment last? The CDC has new recommendations for long-term care centers to continue protecting the age group most vulnerable to COVID-19, and these measures are aggressive. As we enter each new phase of reopening for the country, centers should lag behind lifting restrictions. During phase 1, 14 days after the state begins to lift restrictions, which we are in now, staff should be tested weekly, and all residents if someone displays symptoms. Staff and residents are to be screened daily for symptoms of COVID-19. Visitation, as we've grown accustomed to, generally prohibited except in compassionate care situations. Communal dining limited, but residents may eat in the same room with social distancing, 6 feet apart from tables. Group activity should also be limited. All residents and staff should wear face masks at all times during all phases. During phase 2, if there are no cases of COVID-19 for 14 days, we move on. Staff tested weekly still, continued visitation restrictions, this time with the exceptions for contractors. Limited group activities, including outings, can resume with no more than 10 people. And again, everybody continues with PPE. During phase 3, if there are no cases in 28 days, we can move on to this step, and this is a big one for all you out there. Staff should still be tested weekly. Visitors and volunteers are now allowed inside with screening, protective masks, and social distancing at all times. And staff still screen before each shift, taking temperatures, looking for symptoms. Now, if at any time new cases of COVID-19, even one is confirmed, that center will go back to phase 1. The process starts over. And these are just guidelines. It's up to each state to decide when it's time to move on to each phase and lift restrictions. But they are required to investigate any complaints regarding compliance that puts the health and well-being of residents in jeopardy. In studio, Elias Johnson, Local 5 News. We are Iowa.